Submandibular lymph nodes drain the following areas of the face except medial half of eyelids, central part of lower lip, medial part of cheek or central part of forehead except central part of lower lip. It drains by the submental lymph nodes. Larynx below the vocal cords drain into pretracheal lymph nodes, occipital lymph nodes, mediastinal nodes, or lymphatics along the superior laryngeal nerve. Below the vocal cords, it drains into pretracheal lymph nodes. Nerve supply to the angle of the mandible is by posterior primary rami of C2, C3, greater auricular nerve, maxillary nerve, or mandibular nerve, angle of the mandible by the greater auricular nerve. Nerve supply to the tip of the nose is from the ophthalmic division of the trigeminal nerve, greater auricular nerve, the maxillary division of the trigeminal nerve or mandibular nerve by the ophthalmic division of the fifth nerve. Dangerous space in the neck is found between buccopharyngeal fascia and alar fascia, prevertebral and alar. Buccopharyngeal and prevertebral fascia are none, so it is between buccopharyngeal and alar fascia. Which muscle is attached to the disc of the TM joint? Puccinator, lateral pterygoid, masseter or temporalis? Lateral pterygoid is the correct answer. Maxillary tubercle gives attachment to lateral pterygoid, medial pterygoid, temporalis or masseter. Maxillary tubercle, it gives attachment to medial pterygoid. Vidian nerve is also known as nerve of pterygoid canal, greater petrosal nerve, lesser petrosal nerve or greater auricular nerve. It is also known as the nerve of pterygoid canal. Right recurrent laryngeal nerve loops around right subclavian artery, right axillary artery, right external carotid artery or right superior thyroid artery. It loops around right subclavian artery. Left recurrent laryngeal passes between trachea and larynx, trachea and esophagus, esophagus and bronchi, esophagus and aorta. Left recurrent laryngeal nerve, it passes between trachea and esophagus, tracheoesophageal groove.